Hello, everybody. My name's Madeleine Duncan, and myself and Marilyn will be chairing this session. So I hope you've had a chance to stretch your limbs and that you're ready to engage with us on this panel where we are going to be considering some of the themes that have emerged from the conference. So Marilyn and I welcome you to this panel presentation, during which the panelists will share comments on the themes that have been emerging from the Congress. We invited the WFOT program, a WFOT program convener from each of the 7 global regions to participate. So they are from your right to left, Peter and Da from the African region, Athena Tsai from the Asia Pacific region, Liliana Alvarez from the Latin American region, Leslie Garcia from the Caribbean region, Sandra Bressler from Canada and USA, Marella Barlau from UK, Europe, and then finally Hashem Taria from the Arabic region. What we did was that we asked each panelist to recruit theme listeners to help them identify key points arising from the Congress program that they thought warranted consideration in their region. The panelists then met yesterday with theme listeners to synthesize their respective insights into one or two overarching themes with proposed actions for regional post-Congress consideration. So the session will unfold as follows. Marilyn will first give a brief overview of the WFO Global Health Policy Directions, after which each panelist will present their deliberations, a summary of their deliberations, and then we will take questions from the floor. So let's have fun together. I'm going to invite Peter. First Marilyn and then Peter. First you.
Me,
you.
Okay, before I start talking about global health policy, I would just like to personally thank and congratulate Karen Whaley-Hamill for a very inspiring and thought-provoking keynote. And I particularly am most grateful for the confirmation through that keynote that WFOT are well and truly headed in the right direction. So thank you, Karen. As I indicated in the WFOT plenary session, WHO is really bringing out some very innovative and forward-thinking global health policies. If the 20th century was a century of cure and medicine, the 21st century is the century of rehabilitation and participation. Some documents that have really impacted on this have been the World Health Report, published in 2010, which led to the Disability Action Plan. The World Report on Aging and Health and the subsequent action plan, the Strategy for Management of Non-Communicable Diseases and Action Plan, the documents around the health workforce, and in particular the rehabilitation health workforce, the Mental Health Action Plan, and the Major Assistive Technology Initiative, leading to the notion of universal health care and the opportunity to leave no one behind. So I'd just like to very briefly talk about what WFOT is doing in conjunction with WHO. And obviously we talked about this the other day, so I'm not going to read everything that's on the slides because I can't see it anyway. We all know that. It's got big again. Thank you. But the departments basically that we're dealing with are mental health, human resources, aging and health, the family of international classifications, and disability and rehabilitation. And again, just to recap, we have some substantial projects running in those areas. And I'm not going to read these out. So these just gives you a flavour for the projects that we have running. And the whole premise of all of these documents, all of these strategies, is to assist people to live the very best life they can within their own particular cultural context. And I think that's probably going to be enough from me. Thank you.
Peter? Yeah.
Thank you. Well, I'm here representing what actually resonated in the whole number of days we've spent here during Congress. In addition, I think she's left. Oh, she's around. In addition to what Marilyn has said, and then our standing innovation to Karen's speech this morning, I would say, what a fantastic keynote address. And I'm commenting on this because it's giving us the more opportunity to key into whatever she said. Yeah, from Africa, we are saying, we're talking about this rehabilitation 2030, meeting the SDG 3. And, well, this is what we are saying, that we should decolonize Africa's curriculum and so that we can have the ripple effect in our practice, so that we can contextually, our service users can contextually experience what we are in or what we have for them. So you can see us over there and then trying to make this point out clearly. We are saying there's a need to develop policies that promote relevant information gathering for rehabilitation practice in Africa. We are saying this because we realize that most regions in Africa lack relevant policies for rehabilitation. And we're also saying probably this due to the lack of data and statistics. That's inadequate research evidence in rehabilitation to inform policy formulation. We also saying most countries lack contextually relevant assessment tools that capture the needs for rehabilitation for Africans. And we are saying all these have come as a result of probably inadequate occupational therapy professionals in most African countries. So we're coming up with a regional action. We are saying it will be very good to use information communication technology to disseminate information on rehabilitation. We're looking at occupational therapists who we have learned to be linking other MDT members to service users. We've heard this word, gluing other professionals together to reach service users. We are also saying ICT could be a means to promote access to knowledge on rehabilitation. We further on talking about the need to increase participation and engagement in occupation. We further on talk about promoting reintegration in the community. And the other point is to support, to educate more occupational therapists in Africa. And then lastly, we're talking about this, there should be easy accessible support from WHO, as we heard from our rep, Satish. All these things coming together, we believe we will be able to encourage good health and well-being on our continent. Thank you very much.
Hello, good afternoon. I'm Athena Tsai from Taiwan, and I'm currently the program coordinator of Standards of Quality for WFOT. And today I'm speaking on behalf of Asia Pacific region. And as you know that we have the Asia Pacific OT regional group, and you can see the logos here. Okay, so half of the world population actually live in the Asia Pacific region. As you can tell from the census data that there are the top 5 countries with the highest population, and most of the countries here, we require development in terms of economic and also the development of manpower of occupational therapists in the region. And the average population with people of age of over 60 is 12, which seems to be like equal to the average of the world, the data of the whole world. However, there is a very strong imbalance between countries. For example, you can see from the slide that Japan has like as high as 33% of the population with people age over 60. And among those groups, we still have like South Korea, Taiwan, Hong Kong, Singapore, who also have like more than 20% of the population are over 60 years old. However, in the South Asia countries, we have a couple of countries who look so young. They have like only like 8 to 9% of the population is age of 60. So there is a very strong imbalance between countries in this region in terms of aging and health. And at the other side, we can look from a statistic that Asia-Pacific region has the lowest annual net migration. As in the past 10 years, we have like a minus 1.1 and minus 1.8 for this net migration, which means that many people are actually moving out from the Asia-Pacific region. And where do they go? They go to Europe, they go to North America. So through this review of the current population and popular health condition here, then we kind of identify 2 impairment issues. First is aging problem, and the other one is a migration for this region. And for the aging problem, we would like to refer to the WHO global health strategy with aging and health, and also the long-term care system development to be a reference or the kind of guideline for the development for the people in the Asian Pacific region to face the challenge. And the theme that we heard from the Congress, and also in this year in the council meeting of WFOT, we have noticed that reablement has become one of the emerging direction for the practice of occupational therapists who work for the elderly. However, from the evidence, we know that most of the evidence are from part of the European countries. And so if this is the direction for the OTs who work for the elderly, then for this region in Asia Pacific, we are desperately want to have an Eastern or the reablement for the local contacts in this Asia Pacific region. So we would like to suggest the action for this region is to develop and validate the local model of reablement. And as for the migration issue, we found that the human rights, health, and poverty reduction strategy by WHO as a very important global strategy. And what we heard from the opening keynote speech by Dr. Ilwani is they have putting a great emphasis on occupational consciousness. And for people like in Asia Pacific region, perhaps that the new issue is that there are more and more Asia Pacific people moving to other countries, and actually they are minority who living in another continent or in another country. So that is kind of across the region, and it's not an issue back home in the Asia Pacific country. It also become an issue in in North America and also in Europe. So the suggested action that we would like to raise for the Asia Pacific region is that we would need to put an effort for the advocacy of occupational justice, not only through the person, but also the family, community, professional organization, nationally, and also regionally and globally. And to achieve this to goal or to make those actions successfully, we definitely need to have a collaborative effort from each occupational therapist, not only from Asia Pacific region, but it's from all over the world. And also we need to have a collaborative effort through the member organization and the regional group, as well as WFOT and WHO. Thank you.
Buenas tardes, colegas. Les extendemos un saludo desde Latinoamérica. Good afternoon, colleagues. We extend you a greeting from Latin America. But what is Latin America? Often referred to as a whole, as one place, Latin America is truly a very diverse group of nations with different cultural backgrounds and heritage that really stems out of the diversity of our ancestors and the First Nations peoples that inhabited our territories. So diverse, yes, but also a sisterhood of nations that have shared similar struggles and similar wounds. Colonization, military dictatorships, war, corruption, just to name a few. And it is through these challenges that with time and with effort, we have learned to stand together, to resist together. So when a group of us met and discussed what it is that we take from the WFOT 2018 Congress, we thought we would summarize it in a lesson and a call to action. The lesson can be best captured by Professor Eluani Ramugundo's words in her keynote address when she said occupational therapists must be activists. And Latin American occupational therapists are and must continue to be committed to embracing the political nature of occupational therapy practice. In 2016, the World Health Organization published a report exploring health inequities. And they said something that we found fascinating, that there seems to be a gap between the rhetoric around the unjustness of inequality and the practice of implementing change. And Latin American occupational therapists are committed to stepping into that place and making change happen. So our call to action is this: we need more and more aware occupational therapists in Latin America who are committed to first healing our cultural identity, to recovering what is truly ours, the knowledge that belongs to us, and the occupational therapies, as we often refer to them, that are truly ours. And two, to embracing, defending, and promoting occupation as a human right, because only then will we be able to truly build societies that leave no one behind. Thank you.
Good afternoon, everyone. I'm Leslie Garcia. I'm from Trinidad and Tobago, and it's an honor to be here to represent the Caribbean region. The Caribbean region is diverse as well. We are made up of 27 countries with 42 million people who speak 9 languages, not including indigenous languages, which haven't been counted. In the Caribbean region, 76% of all premature deaths of people between 30 to 69 years old are caused by chronic non-communicable diseases, and 78% of all deaths are caused by NCDs. The 4 main conditions are cardiovascular conditions, cancer, diabetes, and chronic respiratory disease. Tobacco, harmful use of alcohol, unhealthy diet, and sedentary activity are the main causes of disease. PAHO, the Pan American Health Organization, has an action plan for 17 countries to reduce NCDs, but this goal is not going to be reached by the targeted 2025. One of the main PAHO strategies of addressing the NCD epidemic relevant to occupational therapy is to implement health training and increase the skills of personnel in NCD detection, screening, and management. PAHO's goal, although highly medical, is loosely associated with the World Health Organization strategy of promoting increased awareness and understanding of interaction between health, the environment, and development among leaders and the public. The World Health Organization suggests that in doing so, we would be able to strengthen community action for health and sustainable community development. However, in the entire Caribbean region, there are less than 70 occupational therapists. Though this number is growing, in the present our actions need to be focused on community-based, community-born projects that can enhance the ability of citizens to develop skills and abilities to help, support, and inspire each other. This is what we have seen and learned throughout this Congress here in South Africa. For this reason, we have identified, out of everything we've seen from the Congress, the keynotes, Dr. Hamill, Elewani, Ragmundo, that our main goals need to be the development of our communities with respect for the diversity of each context. Human rights, of course, cannot be left out of this agenda. This Congress has emphasized that community-based organization, the impact that community-based organization can have on health and well-beings of peoples, communities, and indeed nations. Over the past 4 days, we have learned of the power that grandmothers, fathers, caregivers, and mothers can have on improving the lives of those around them by engaging in culturally relevant activities. Indeed, occupational rights equal human rights. This Congress has also identified and specified that community programs cannot be impressed upon a community, but need to be developed with and within communities. This is particularly necessary in our region where our histories, cultures, and political agendas differ. For example, in Trinidad and Tobago, national problems, occupational problems such as drink driving and crime associated with the drug trade are local problems that affect lives. In Dominica, displacement as a result of hurricanes has led to the risk of human rights violations and occupational disruption. Across the Caribbean, queer people are occupationally marginalized and are at high risk of mental health distress. Despite these disparities and diversities, we believe that it is possible and necessary for occupational therapists in the Caribbean to enhance their competence in community development, and in the absence of educational programs in the region up until 2016, all therapists currently working in the Caribbean have been educated in the global north. Thus, our education would not have been specific to our context or sensitive to these new problems. Thus, we think creating one, broad regional guidelines for community development, as well as integrating programs, our educational programs going forward on educational, community-based, occupation-based community development into our education programs going forward will ensure that all currently practicing occupational therapists and the future occupational therapists to graduate will be able to work with their respective communities to develop occupation-based programs that can improve the well-being and quality of life and participation for all across our region. And with a special thank you to Dr. Hamill, I will say I will start with myself in decolonizing my mind with a shameless, biased perspective from the South. I bought the book. Thank you, South Africa.
Good afternoon. My name is Sandra Bressler, and today I have the privilege of sharing thoughts from Canada and the United States of America. So we've had many thoughts, and we had a very active discussion in our group, and we decided to share with you what we felt would resonate with the theme of the Congress and what we've learned. And we wanted to share with you our context. So firstly, we wanted to share a key issue in public health. And I don't believe that this key issue is unique to our region, but it is certainly a very important public health issue. In both of our countries, access to universal quality health and social services and supports is really a concern for our citizens. In terms of well-being, we feel promotion of well-being through development of healthy lifestyles is something that is important, and I want to recognize after the keynote speech that we've heard this morning, we will define, and I think we all need to think about what a healthy lifestyle is within the context of the lifestyle that there is an opportunity for. Human scale developmental challenges. There is isolation and inequality because of age, social status, stigma, and sexual orientation in our region. Trauma, including violence, abuse, and bullying. And I know the media has shown this, if you watch CNN. This has become and through other social media, I think you have seen that these are key issues in our region. And substance abuse problems across the lifespan. Not only children, adolescents, but seniors as well. So this has really become an issue for us. So again, we had active discussion about what would be one WHO global health strategy pertinent to Canada and the United States. And we felt that non-communicable diseases, which include mental health and substance abuse, is a strategy that certainly resonates in our areas. True. A theme that emerged from Congress that resonated with our regional imperatives, the importance of a therapeutic relationship in quality practice, embracing humanity, while challenged with the imposed time constraints and productivity standards. And this is something that we have heard in the talks that we have been to, and this is something that really resonates with occupational therapists in our regions. And then what would be one regional action? To expand the development of the distinct contribution of occupational therapy to interprofessional primary healthcare teams to facilitate participation in everyday life. We feel that this is an important area. It's a growing area in both countries where occupational therapists really have the opportunity to engage with our clients, our patients, persons, whoever we are engaging with, to make a difference to their everyday lives. Thank you.
Good afternoon. My name is Mirela Burlou. I'm from Romania. And first of all, I want to thank you for their input in preparing this presentation, to Elisabetta Roldao from Portugal, to Olia Mangusheva from Ukraine, to Yara Peterko from Austria, and to Sibyl Izugaran from France. The current European policy for health and well-being is drafted on World Health Organization vision and mission on global health strategy and in support to the World Health Organization European Framework Health 2020, aiming to, I quote, to improve the health and well-being of population, reduce health inequities, and ensure sustainable people-centered health system, end the quote, as well as on the United Nations inclusive health policies, aiming to provide regulation through a positive attitude, awareness, and appropriate health, social and rehabilitation services for people with disabilities. Therefore, the reforms of the last decades in the most of European Union countries on health, health insurance, and health protection and rights of people with disabilities are focused mainly on prevention and primary health care through immunization program, monitoring program for chronic disease and risk factors, through family planning, screening and early intervention, prevention and healthy workplace. That some of the countries related to be pertinent to Goal 1 of the World Health Organization Global Health Strategy, Health Impact. Another area identified by European reform is the provision of minimum packages of services through more effective emergencies and/or community-based services, which has a strong prevention component for vulnerable population. Also has been related to the goal number 2 of the World Health Organization Global Strategy, Health Security. Another area identified relevant for the EU reform is development of the private health area, which is well received by middle and upper income population, which basically is given by private companies to their employees as part of benefits package. And the fourth area has been established as being a clear relationship between health and social care system, ensuring that people with disabilities, basically who are registered within their national authority of people with disabilities, are included in the health protection program, social services, supporting rehabilitation centers, assistive technology, prevention program, and access to treatment and long-term care. To some extent, this area is related to the goal 3 or goal 4, depending on each country policy. Despite the strengths of the inclusive health policy in European countries, there are still weaknesses in providing this kind of services, which consists in low funding, unclear sustainability, stigma, disparity between accessing resources, poor communication and data collection, lack of experts and knowledge, as well as lack of awareness in general population on available community resources, which makes it a little bit difficult to implement the theory and the policy in reality. Therefore, during the Congress, we heard about healing work. We heard about activism and attitude, equity versus equality, policies relevance. And main of all, we heard about a call of action in rehabilitation and occupational therapy towards 2030 that urge us as professionals to action aiming to address human rights by developing or reviewing education programs in order to ensure that occupational therapists are equipped with proactive attitude, knowledge, and skills to deliver services, enabling them to design sustainable projects and program targeting deinstitutionalization, community-based rehabilitation, inclusive education, universal design, human displacement. Another action could be facilitate equal access to available and appropriate use of resources within the local communities through collaboration and networking, through strengthening our global profession, by partnering nationally as well as internationally, positioning the profession by embracing and advocating for position statement within our national policies in order to create a more environmental friendly opportunities for all. Thank you.
Hello, everybody. My name is Hashim Abu Tariya. I am from Jordan, and I'm here today talking about the Arab region. Okay, I'm sorry. Start a little bit with the history of occupational therapy in the Arab world. Started in the 1980s on the services level. OTs came from USA, from Europe, provided services in various hospitals and rehabilitation centers until late 80s. An OT program started in Jordan in the diploma level, 1989, then moved in 1999 to 3 public universities, followed by other countries, Palestine, a couple of programs. Kuwait in 2009 started their OT program. Saudi Arabia 2010, followed by Morocco last year. And Lebanon also, they have another OT program. So out of the 22 Arab countries, only 6 Arab countries have OT programs. In that region, unfortunately, there are less focus on rehabilitation services. Most hospitals do not even have rehabilitation centers. We have some or several private rehabilitation centers with a focus on pediatric rehabilitation. Another area of concern is the psychosocial settings, driven by the medical model with no or less focus on rehabilitation. So most psychosocial settings, you don't find OTs. Another theme is the vast inequality of resources between different neighboring countries. You know, we have in the region very rich countries and we have very poor countries. So this inequality of resources reflects on the quality of health services, and it varies widely between countries. Another theme is the cultural context and the reliance on interdependency versus independency. You know, the model of, or the family structure over there is we have the extended family structure rather than the nuclear family structure. However, I believe in the coming 1 or 2 decades, there will be some social transformation when more women will join the workforce, and this will leave elderly people and people with disability. They will need someone to take care of them. This means more need to establish nursing homes and daycare centers. Themes emerge from the WFOT Congress. The political context over there is overshadowing all other contexts, unfortunately. It influences the social context, the cultural context, the personal context, virtual, temporal, all contexts are influenced by this very strong and powerful context, not only in those countries. You know, those countries have lots of problems, humanistic issues, but it's all reflected on the whole Arab region. According to the United Nations, I just want to bring one example from Syria. According to the United Nations Refugee Agency, conflict in Syria still continues to drive the largest refugee crisis in the world. Over 5.6 million Syrian refugees, 2.6 million being children. 35% of Syrian refugee children are out of school. They face early marriages, and forced child labor are compounded by lack of livelihoods. So most concepts emerged or discussed in this Congress applies there. Occupational injustice, occupation apartheid, speaking about Gaza Strip, that's living under siege for the last 12 years. 50% unemployment rate, 750,000 living there in a place the size of 56 square kilometers. I'm sorry for the strong pictures. Reminds me of the concept of placelessness. People around the world wake in the morning looking at the weather, right? However, in our region, we wake in the morning looking how many person or people were killed, how many houses were damaged, destroyed, and how many person displaced. Proposed actions in that region, as I told you, minimal OT are there. Only 6 out of the 22 countries have OT, so we need to do a better job raising awareness about the need of rehabilitation services, especially occupational therapy services, concerted and coordinated global action by all stakeholders. We need to provide immediate support for those countries and people who suffer wars and who suffer war-related immigration or displacement, not only to Syria, Yemen, but also to the neighboring countries. Just imagine, I am from Jordan. Like a few years ago, we used to be 6 million. Now we are 9 million. We have at least 2 million Syrian refugees came to my country. And they are our brothers, our sisters. We cannot close the borders. And Jordan, just a little bit about it. One of the top 5 countries, poorest countries in water resources, in addition to the economical problems that we face. Occupational Therapy Association need to reach WHO offices in the region and discuss channels of providing OT services for affected people. We need to open the access for occupational therapists as well as rehabilitation professionals to provide voluntary services and community support. We hope that one day we will have peace, not only in the Middle East, but all over the world. Thank you very much.
Thank you, panelists. I think you've provided a really clear picture of a small pinprick of issues that actually need to be addressed, but at least it's a starting point for going forward.